All right, everyone. So today we're actually talking about vitamin D deficiency and sort of how it relates to its importance in our cancer recovery and prevention strategy. So I posted something up not too long ago. I don't know if you got a chance to take a look at that, but I'm going to just sort of quickly go through that first. And then we'll talk about some tips. And also I'll be sharing the type and brand that we use at home for vitamin D for all of our family members. I have 3 kids, as some of you might know, and we all use the exact same product. I like it because it's a professional branded product, which you'll see actually matters. So first of all, let's talk about vitamin D deficiency. Vitamin D deficiency is actually a global epidemic right now. There are so many people all over the world who actually have a deficiency in vitamin D. So it's not just something that cancer survivors are facing. It is something that a lot of us probably have. Now, cancer survivors, though, specifically seem to have a higher incidence of vitamin D deficiency than the general population. So if we look at the research here, it says that as high as 45% of colon cancer survivors, 64.8% of breast cancer survivors, and 72% of all cancer survivors have a vitamin D deficiency, with higher incidences actually found in women. This is really important because that means if you're a woman out there, this is probably something that you do have to pay attention to. Now, this is actually higher than the general population. If you're wondering how much higher, the general population, for example, in the US, if we're looking at just the adults, about 35% of adults in the US have a vitamin D deficiency. And as you see, a lot of the other numbers were actually higher than that. So, does vitamin D deficiency increase our risk of cancers or worsen prognosis? This was a really great question that I got asked many times. And what the research actually shows is that both things may actually be true. Vitamin D deficiency has actually been associated with many different types of cancers. We're talking things like colon cancer, breast cancer, multiple myelomas, but also it has also been linked to potentially increase cancer risks as well as worsen survival or prognosis. So there is research to show that vitamin D may actually be really critical for those areas as well. Obviously, we always need more research, but when we see something that's actually not only beneficial for this particular area, but multiple different areas, because when we look at vitamin D and what it actually helps with, it helps with things like our immune system. It can help with things like our brain function, boosting mood, metabolism, and weight loss, maintaining a healthy blood pressure. We know that it has some benefits around skin aging and also firmness as well as repair and growth. We know that it's helpful for bone health, joint pain, muscle pain, and lowering potentially that cancer risk, as well as potentially helping with cardiovascular disease, diabetes, and autoimmune disease. So there's many different potential benefits here in getting to that normal or optimal vitamin D level. Now, some of the symptoms that you could be getting, and one of the ways or some of the ways that you could know that you have a deficiency, is if you have fatigue, for example, or low energy levels that don't seem to have any other correlated underlying causes. So they've looked at everything else, but they're like, we're so wondering why you feel so tired. One of the tests that you may want to do is actually around your vitamin D. Things like bone pain, muscle weakness, and aches, mood changes, osteoporosis, or bone health issues could all be signs of vitamin D deficiency. But there's also one symptom that's also a sign of vitamin D deficiency. And that symptom is actually feeling nothing at all. A lot of times people don't actually know that they have a vitamin D deficiency, and the best way to know it is actually to test for it with a blood work. So let's talk about supplementation then, because oftentimes when my patients come in, we take a look at their supplements. I've had patients coming in who have been taking like 10,000 IU, which is an enormous amount of vitamin D, on a daily basis before they even came to me. We measured out their vitamin D in terms of their blood work, and they were still deficient. And the thing that we did that actually shifted their vitamin D levels was switch them to a different, more professional branded vitamin D that actually absorbs better. And with probably half the dose that they were on for multiple years, we were able to increase their vitamin D levels within 3 months' time. So that's how effective getting on the right type of supplement can be. Now, the best form is actually vitamin D3. I do like something like this product. Genestra is one of, or considered a professional branded product. And what that means is that it's higher quality. Usually it's more highly absorbable than some other brands that might be out there. It could be a little bit more costly, but I do also find that if it works better and you have to take less, it actually may be more cost effective. Now, vitamin D is actually a fat soluble vitamin. You do have to eat it with a food in order for it to absorb best, but it can be toxic in high amounts, which is why testing is actually really critical, especially if you're on certain medications. So things like chemotherapy, for example, breast cancer hormone therapies like Tamoxifen or Letrozole and other aromatase inhibitors, things like laxatives, blood pressure medications, cholesterol meds, acid reflux meds like PPIs, for example, can all impact the levels of vitamin D. Now, most of the times it actually causes more of a deficiency. In the case of Tamoxifen, which is actually very different than how the other medications may impact vitamin D, it can actually increase your cell's sensitivity to vitamin D by 2,000 to 4,000 folds. What that means is that with lower dosages, your vitamin D levels can actually increase a lot higher and faster than without being on Tamoxifen, meaning that that assessment is actually really, really important, especially if you're on vitamin D and you're on Tamoxifen, because we know that, again, vitamin D can be toxic in high levels, and we want to make sure that you're at the optimal levels, neither low or too high. So how do we actually test for vitamin D levels? The best way is actually to test what's called the 25-hydroxy vitamin D, not the 1-25-hydroxy vitamin D. The 25-hydroxy vitamin D is actually the most accurate form of testing that we could get. It's a blood work that you can just ask your doctor to do for you. And basically what it tells you is whether you're deficient, you've got enough, I guess, within the normal ranges, or too much. Now, you do or should be working with a healthcare practitioner who can actually help you assess how much you actually need. Do you need to take 2,000 IU? Do you need to take 3,000 IU a day? And then if you're deficient, or if you've got even too much in your system, to assess and then reassess again with the same blood work to ensure that you actually have sufficient amounts. Again, this is not only important potentially for cancer recovery and prevention strategies, but when we're looking at things like hitting menopause, for example, and looking at increased risk for bone health issues, even if we hit menopause naturally or forced because of therapies, vitamin D is actually such a critical component there. If we're looking at optimizing our energy, if we're looking at decreasing muscle and joint pain, this might be one sort of strategy that you can layer on top of other ones to really help you feel your best and have something that's also beneficial for you in so many different ways, not just one. So this is definitely something that you should get assessed. Make sure that you work with someone to ensure that you're getting the right type, the right dose, and that you're taking it at the appropriate timing compared to other medications, for example. Those are other considerations that they would have to make. And, in general, such an easy supplement, a very effective supplement for many different reasons that a lot of us probably need at some point or other. But the only way we'll know how much we need is actually through that assessment. So I hope that's helpful to you. Please subscribe as well as join our email list for more tips and information on cancer prevention and recovery strategies. And I'll talk to you later.